Welcome back to this week's episode of Promising Young Surgeon. I'm your host, Dr. Frances Mei Hardin, and today we're going to have a very real conversation about external validation and addiction. My guest is Dr. Brett Cordes, a surgeon who has faced immense personal challenge and emerged with invaluable wisdom. And so we will go over, addiction, experience in a residential facility, and the critical journey towards healing. And very importantly, I think for all of us, we're going to dive deep into the theme of external validation, the drive for recognition from others. For a lot of us, it's a main driver in life until we really look at it directly and examine ourselves. And the question is, how do we move beyond that to find true purpose in life and also figure out what we really want? I would like to now introduce our guest, Dr. Cordes. Dr. Cordes attended LSU for his undergraduate studies, where he graduated with a BA in history with summa cum laude honors and is a member of Phi Beta Kappa. He then attended LSU School of Medicine in New Orleans, graduating as a member of AOA. He completed his residency training at Baylor in Houston, Texas, and then pursued a career in private clinical practice within the Texas Medical Center, while serving as assistant clinical professor for both Baylor and UT Galveston. Dr. Cordes enjoys vacationing with his wife, Katie, and their children, Kevin and Alyssa. In his personal time, he can be found exercising, playing disc golf, watching or attending LSU sporting events, or working in his yard. And of course, we always like to share a fun fact about our guests, something maybe lesser known that you wouldn't see on a CV. And so I wanted to share that he has a photographic memory inherited from his paternal grandmother. He's written a memoir called Cancer is for Older People, and that was about his battle with Non-Hodgkin'S lymphoma as a teenager. And very fun fact, he has written, performed, and had rap songs produced. Brett, thank you so much for joining me here today. It's a privilege to welcome you on.
Absolutely. Thanks for having me.
I mean, I kind of feel like we're going to have to invite you to rap at some point, but I appreciate we got to get to the meat of what we're here to discuss today before we go to some of the more fun stuff.
All right. That sounds good.
So, I would love if you would just start kind of broadly with some of your background and helping all of us understand your journey into ENT and some of your journey within ENT that led you here today.
Okay. Well, given our audience and given kind of what the topic here today is, I'll start way back, before I was born. So my dad is a PhD full professor of mathematics at the college level, and my mom taught English also at LSU. And my sister is an attorney, and both grandparents were engineers. So,
oh my gosh,
I grew up in a heavily academic household. And my dad also played college sports. And so athletics and sports were also kind of a big priority. And so by the time I was maybe 7 or 8, it was never told or taught to me, but I just kind of accepted the fact that anything less than winning or being extremely successful was really not something that was acceptable. Not because I was told it was unacceptable, but if I wanted to be, par for the course for the rest of my family, that's what I was going to need to do. And so from a very young age, without even knowing it, I was under a lot of pressure to perform per se. And
I'm curious, did you ever see it modeled for you that winning is really important? Did you see people model, okay, we didn't win, but we had fun, or we didn't win, but we'll get them next time? I mean, was that any element of what you experienced?
No, that was not modeled for me. But I do want to stress that the opposite also wasn't modeled. So I was never told that winning is everything. But, my dad was a college basketball player. He is a world-class bridge player. He's an accomplished chess player. He was almost a scratch golfer his whole life. And so it's just that's what was modeled for him. But he never
Just
pressured me into that.
excellence.
Yeah. Yeah.
Mm-hmm.
And so, but yeah, I mean, I would say a normal childhood, lots of sports. I was always a good student. Graduated high school in Baton Rouge and then went to LSU for 4 years and then on to medical school.
So kind of the straight and narrow path.
Yes, although I was, like you mentioned previously, I was diagnosed with non-Hodgkin's lymphoma at the tail end of my freshman year of college.
Mm-hmm.
And I'm a history major, so at the time I had no idea what I wanted to do.
Mm-hmm.
And so I was taking classes so it would, they would count and go toward whatever I decided to major in. But of course, after it was a 16-month kind of fight with cancer. There was one recurrence, but that experience did inspire me to go to medical school. So there was a lot of good that came out of that, actually.
Wow. Yeah, I didn't realize how much that experience actually shifted the course of your life then, if you weren't planning on medical school prior to your diagnosis and cancer battle.
Yeah. Yeah.
Did you have any idea before then, or it really wasn't on the radar?
Well, my mom, most of my extended family are either academicians and teachers or professors or attorneys. There were no nurses, there were no physicians in the family. But my mom did often say that she thought I'd be a good doctor because I had a good smile. I remember her saying that several times. But again, they weren't like, you should go to medical school, you need to go to medical school. It was never a pressure situation like that.
Yeah, and I definitely, I think that in my experience, there was a lot of, I'm the child of a attorney and like a chief financial officer, pretty high achieving. And they were always like, we need a doctor in the family. We do want a doctor in the family. And I'm an only child. So it's kind of like that was the path laid out. But I think that that's wonderful. And, I can really relate to when you're surrounded by excellence as a child, then there is this interesting like environmental driver, I think, to be part of that and to fit in with that.
Yeah, absolutely. Just to fit in with your family, with the the table talk, so to speak. Yeah.
Yeah. So then, well, and of course we are both ENTs, but then what led you during medical school to pick ENT? And then what was your training experience like?
Okay. So when I entered medical school, my idea was to be an emergency room physician. ER was a big show back then. And so I felt like it fit my personality. And so I thought that I wanted to do emergency medicine. And so I started doing some research along those lines and hyperbaric oxygen therapy. And that lasted for the first 2 years of med school. ER was going to be the plan. And then my very first rotation, third year, was surgery. The first 4 weeks of that 3-month rotation was trauma surgery. And after about 5 days, it was pretty obvious that I wanted to be a surgeon. And this is good information for med students. But what made that obvious was that I got along with the people that were residents. The personalities of the residents and the people on the team meshed with mine. And so that's what did it for me. Fridays after Friday clinic was over, we'd go have a drink at the bar across the street. And it was just like old college buddies. So, but I did have the forethought. I didn't want to do general surgery. I didn't want to work 90 hours a week. Mm-hmm. And then my last 2 weeks of my surgery rotation was ENT. And then everything came together. It was, kind of half clinic or 85% clinic, the rest surgery. You get to know your patients. You get to treat patients from, the cradle to the grave, so to speak. I like the anatomy. And again, I like the personalities within surgery. Everyone has their own opinion, but within surgery, ENTs are generally a little more chill than some of the other subspecialties. But yeah, that's at the end of my surgery rotation, I knew that's what I wanted to do.
I'm definitely with you there. And I have always loved working with my hands, in capacity. So I knew I wanted to be a proceduralist. But when I was 20 years old and working in an ENT department full time in outcomes research, that was when I really just, met the whole department. And they were kind of explaining to me because surgeon was really not on my radar. I had a lot of friends who were like physics PhDs and biochemists and things like that. And I really was actually drawn to that personality. I think that suits me better. But the ENTs got me because they were like, we are actually more of like the weird but nice surgeons. I was like, weird but nice sounds great. Like I'm in, because I had kind of voiced like, I don't love some of the bad machismo, the posturing, like I'm not here for it. And so that's funny because that's like a little bit foreshadowing, I think, for me. And then subsequently how my decade into ENT went after that. But it's like, even as a young person, I kind of was side eyeing surgeons a little bit, but the ENTs did lure me in with kind of like a gentler spirit and kindness. I don't know that it's that way everywhere though.
Yeah. I mean, I think ENTs are kind of the nerds of the surgical field, with ortho being on the other side of the spectrum. But yeah, nice, a little more relaxed, but still surgeon,
Yeah, and still surgeon, again, and no offense, but we do joke about this on this podcast. But like, no offense, but even if you're 5% still surgeon, that puts you in the 90th percentile, like craziest people on earth. So, take it with a grain of salt that we're like, they're the good guys of the bad guys.
I'd agree with that.
I'm just kidding. Yeah. But so then, but like, I appreciate what you're saying. It sounds like you naturally fit in very well. So far, I'm primarily just hearing the story of someone who is killing it. They come from a long lineage of people who are killing it, and they fit in and they're well adjusted and they're doing well the whole time. So, what was training like?
Okay, so, and I do want to mention this because it's going to be relevant later on. But I was one of those med students who I studied hard and I had a very good memory. And so I had a great memory and I was studying harder than other people. So I was doing extremely well, but did not tell anyone. None of my friends knew how well I was doing. And so at graduation was the first time people even realized that I was a good student because I won all these awards for highest GPA and, highest grade in different classes. And people were surprised because that's just not something I ever discussed. So I was kind of a hotshot med student and then proceeded to residency, and that continued. I won a lot of teaching awards and research awards, and my drive for that was to be the best. It wasn't to do my best. It wasn't to necessarily provide the best care, although those things are one and the same. But it's important to know that what was driving me was the end result and what people's perception was of me. And so, yeah, I love training. The historical stereotype of Baylor is of a very malignant surgical program. Michael E. DeBakey was heavily involved in it. And he's as old school.
Oh, wow. Of the
as you could get. Yeah.
Yeah. That's an instrument in the OR for people who don't use DeBakey's, but wow.
Yes. And so by the time I got there, this was the 80-hour work week was just about to be instituted. But the surgery program might have been malignant. I did not feel that the ENT program was malignant, but it was pretty hardcore. My intern year was very hardcore. But I enjoyed residency. My year, we had 4 people match, and I was the only guy. So I had 3 female resident mates, and over those 5 years, we got pretty close. I mean, I loved my resident mates. We went to each other's birthday parties and kids' birthday parties, and hung out outside of work. And so, but yeah, I enjoyed training. It was hard, and but I did not feel like I was abused or mistreated. But I will say, I didn't know this at the time, but I will say that I think being a tall Caucasian male helps with that a little bit, in terms of people yelling at me or mistreating me or abusing me or talking down to me. Because talking to other people, who had a different experience than I did. And so again, I didn't realize at the time, but I definitely have come to appreciate that exists.
There's also the smile, as your mom mentioned, and as all of us, anyone watching on YouTube can attest to. No, but in all seriousness, I get what you're saying, and I appreciate you acknowledging it, because I think that even just on face, like, women in medicine sometimes get the crap beat out of them, and they watch white male colleagues, have a little bit of an easier time. And that's not, like, I don't think that that's even the meat of what we're getting into today, but I think that it is probably even very healing for people to hear that they aren't imagining it sometimes, if there's like not parity across all people who experience the training journey at work.
Yeah. And I can only speak from my perspective, of course. But what I witnessed is I didn't see any abuse or mistreatment of my female resident mates from staff. But I did see it from other services, from other chief residents, from other upper level residents. And that was surprising and disappointing.
Yeah. And I mean, yeah, there's so much, it's a whole Pandora's box. I think the culture of medicine and like this, physician on physician crime, healthcare worker on healthcare worker crime, and the hierarchy of specialties, the hierarchy in medicine. But I mean, I guess that while you are painting a picture of somebody who is motivated by these external factors, like the perception of success and accolades, for sure, it just feels like you're killing it. Like, I'm still impressed. I'm like, okay, this is externally, and I'm sure you experienced this at the time, because like if we were colleagues, I'd be like, man, this guy's got it all. So what was the next phase of your career like?
So you're waiting for the speed bump.
I don't want there to be a speed bump. It's not like that. I'm not like, I don't enjoy the speed bump for anyone. I don't like it for me. I don't like it for anyone. But it is interesting because, in terms of like a storytelling and like me, the reader, me, the person who's like experiencing the story, I'm like, this is a fairy tale.
Yeah. Well, and I've kind of presented it like this and built it up like this on purpose, because it was a huge surprise for anyone who knew me. Again, I'll just say I got involved with substance use and substance abuse and the disease of addiction. And I can't tell you how many times I heard, "Oh man, you're the last person on earth I would have thought that would happen to." And so I graduated residency and then started private practice with a group in the Texas Medical Center. Actually, it was a group that we rotated with as residents.
Oh, cool.
And so I graduated in 2009 and started working and absolutely loved it. I mean, private practice, finally getting out, was honestly everything I thought it would be. It was fantastic. And from day one, my managing partner and the senior partner in the group, from day one, they told me, don't work too hard. Take at least one day off a week, maybe even a day and a half off a week. And so I can never claim that I was pressured or pushed into overwork or to overachieving. But needless to say, that's what happened. And so in terms of external validation, the objective markers of how well I was doing was how many patients did I see today? How many patients did I see this week? Okay, I saw 57 patients last week. I want to see more than 57 patients next week. Wow. How many surgeries did I do? Okay, I need to increase that. And then I could also see compensation going up, which was important, not because it was compensation, but because it was an objective measure of how well I was doing, how good of a doctor I was. Mm-hmm. And so it only took me about 14 months to build my practice where I was at 100%. And I was doing all the trachs in the hospital, all the consults, building up my practice. I was also, my kids were very young, but after they got to be 5, 6, 7, I was, started coaching their athletic teams. And everything was going great. First 4, 5, 6 years, everything was going fantastic. And then, and I'll tell this story, and I rarely do, but essentially, one Friday afternoon, a rep brought by some samples of a hydrocodone-based cough medicine. And I didn't really think anything of it. But a couple Fridays after that, I decided I'd take one home one Friday afternoon and drink it like it was a beer. And that one decision eventually led into a 5-year gradually increasing addiction to opiates.
Wow.
So why does a 36-year-old doctor who's married, 2 healthy young children, he was essentially living the dream, why does someone like that descend into addiction, And I didn't know the answer to that question for a long time. But essentially, and, there's many levels to this, but essentially, the external validation ran out. And I was at the top of this mountain that I'd spent my whole life climbing. And I'm looking around and I'm asking myself, well, I'm ready for the next challenge. Like, what's next? And then you're doing a great job. And, oh my gosh, you're really helping the practice. And, the nurses in the OR telling me that they love working with me, and all that stuff stops coming in. And I'm just left with myself, And so without that validation, I don't want to say I got bored, because that's not really accurate, but I had an uneasy, anxious feeling in the pit of my stomach all the time. And so that's how it started.
Of course, I have to thank you for your honesty with us and your vulnerability, because I think that it changes lives to hear from people who do know themselves in the way that you do. That's pretty unique. And again, no offense to surgeons, but like pretty unique for, I think, people who do what we do and come up the way that we were brought up to get to this spot. And so, what I want to call out specifically for people who, like haven't lived portions of this journey, but what I think is interesting is this like commonly quoted, probably not evidence-based, but like this anecdotal quote that people say all the time when you're in training, and then like say your mid to late residency in ENT, and people tell you, they say, hey, look, becoming an attending, it's not back to square one, but oh, it's going to be a ride. You're going to learn everything again in a new way. And it takes typically about 5 years to feel like you are at that really comfortable, back to almost autopilot type of spot. Like I've heard people, again, more anecdotally, but like give that type of advice where they're like, it might be, something new comes up multiple times a week for those 5 years, but then you almost plateau. And people say that in this like great way. Like I've heard it spoken about very positively, kind of like, yeah, grind for maybe another 5 years as an attending, and then the next 15 might be like much smoother sailing because you're going to be comfortable. You'll be settled in. And so I did think that that was interesting temporally, like with your journey. It does sound like you had it dialed in, like you're already at incredible capacity. Everyone loves working with you, but it's probably like a well-oiled machine. And so I that did stand out to me in terms of the timeline a little bit. I don't know if you think that there's anything to that.
Yeah, I've never heard that, but I would 100% agree with that. And really, if you match my timeline up, after 5 years, that's when I mentioned, getting kind of bored and looking around and saying, what's next? Yeah, I had not heard that, but yeah, that matches up. And another factor in what happened was, I finally ran into a problem that I couldn't overcome, and up until now, in my life, I could either work hard and figure something out, or I was smart enough to figure something out. But if I put enough effort into it, most problems I could solve. But that does not work with parenting. And I slowly realized that, I can't control my kids the way I can control myself. And so up until then, that was new territory for me.
Yeah. I think that what's so funny though is that even, a little bit of where I've run into and up to problems myself, it's so interesting because it's still like the individual versus the world, like versus other people, where I have had a lot of rigidity in a myriad of ways my whole life. And it's kind of like when my own values aren't reflected externally in the world for a long time, it used to be this existential threat, not specifically as it relates to parenting, but just that realization of like, okay, well, I can't control other people. For many years, I tried really hard and had some success, a modicum of success, at doing it. It's like it worked until it really didn't. And for me, residency was my really didn't. But I guess that when we look at your experience, you mentioned just, yeah, I mean, first of all, is that cough syrup around? I'm not familiar with like any classes of those. I've never like heard of any reps who use like a hydrocodone cough syrup. Is that popular now?
No, in
Was
fact,
it popular back then?
it wasn't really popular back then. It was like a Tussionex,
Yeah.
But no, I think, that particular brand came and went. I certainly I haven't seen it around in the last 6 years.
That's probably for the best.
Right.
But for patients, for the healthcare world. But at what point, because of course, like I assume that wasn't overnight, and a lot of these things, they just kind of happen gradually. And so at what point did you think I need to make a change, or, at what point did a change come about?
Yeah, so it was a very, very, very slow progression. I don't remember exactly, but let's say 2015 is when things started. And I would say by the time it was late 2017, early 2018, I was using almost on a daily basis. It never affected, I mean, to my knowledge or to anyone else's knowledge, it never affected my work as a physician or as a surgeon. And I didn't feel like it affected my home life either. My wife would have a different opinion on that. But it wasn't until 2020, let's see, the pandemic hit in 2019. So my partners became aware of what I was doing. This was in 2019. I lost my job. And then the pandemic hit in 2020. And I didn't go to the inpatient rehabilitation treatment center until the summer of 2020. And that was essentially on an ultimatum from my wife. But that ended up being a very, very good experience for me. Rehabilitation. I learned a lot about myself. And, external validation being one of several of my character defects that I got to work on and I'm still working on. But yeah, it was 90 days and it was, obviously wasn't fun, but it was what I needed and it was effective.
I'm glad that it was a, productive experience. I connect with a lot of, young physicians, of course, mid-career too and things like that. But there are young doctors out there who always want to know, it's kind of like, what are different ways to find a rehab or get into one? Like, was a PHP involved in any way in getting connected with this one? This is something that was privately sought out and then, pursued. Like, because as a doctor, it's tough because it's different for us compared to like a citizen who works in a lab and it might not directly affect, licensing types of questions to simply pursue inpatient rehab.
Yeah. And I have a lot to say and some strong opinions about medical boards and PHPs. To answer your question, because I had already not been working for a year. And so we kind of contacted a person in the area that knew about addiction, and she suggested a place. I was living in Texas at the time. This place was in North Louisiana. And it was renowned as a very, very good institution. So I went there based on this person's advice, and then from there signed up with the Texas PHP. Mm-hmm. And thankfully, this institution was one of only 3 in like a 4-state area that was acceptable to the Texas PHP. I mean, this could be a whole topic in and of itself. But I will just say, in my experience, if I could give one kind of piece of advice, PHPs are necessary. I would recommend that someone get in contact with them if they have a substance abuse issue, but they are absolutely not your friend, nor are they your advocate. So just keep that in mind.
I'm glad to hear that it did happen to work out for you, but agree that feels like a lucky coincidence that the one that you were able to connect with and attend happened to, play for the Texas PHP. And I definitely appreciate, the pearl that you're sharing with people. And I get it. I really get it. And I feel that way to an extent about multiple institutions, and I know we've happened upon a second Pandora's box this evening, but the ACGME, for instance, it plays a very significant and important role in medical training, accreditation of medical and surgical training programs. But agreed, it's interesting the different ways in which we run into trouble if any of us ask it or expect it to do something that it is not designed to do or that is not in its mission statement. So, I mean, I think that's, I really relate to what you're mentioning with even the PHP as an institution.
Yeah. No.
Do you feel like when you went to inpatient rehab that you really had bought in by that point? Or is it something where, you go because circumstances or, familial requests lead you there, and then you were able to buy in while on the journey?
Yeah, that's a good question. I bought in on the drive up there, which is a very specific answer. But that's kind of when the reality of the situation really hit for the first time. You know, my wife is driving me to this rehab. You know, we all have, and I had the same idea about rehabs as anyone else. So it was terrifying. It was scary, extremely humbling. And all of that is good for someone starting the recovery journey. You know, what they say is people don't go to rehab on a winning streak. So I was definitely not on a winning streak. That stopped a year previous to that. But yeah, and it is 100% necessary to buy in if you're going to be successful in recovery. At least that was my experience. So yeah, I bought in from day one, and my counselor was phenomenal. You know, it was cognitive behavioral therapy, individual and group therapy, and it's a lot of work. Rehab's a lot of work. It's not downtime. It's not vacation time. If you want to get better, let me put it that way. If you want to get better. But yeah, I really kind of learned what made me tick, you know, why things that happened in the past and what struggles I had in the past, what led to that, what parts of my personality led to those things. And I also learned, you know, I'd mentioned previously, my friends told me, man, you're the last person on earth we would have thought, you know, would delve into addiction. But I learned that my personality traits, my strengths and weaknesses, which are similar to a lot of physicians, a lot of overachieving professionals, those traits are an absolute setup for addiction. Because if external validation is one of them, perfectionism, if that's one of them, low tolerance for frustration, emotional immaturity, you know, bad temper, all that stuff combined is a setup, because when the validation goes away, you better have some coping mechanisms available. And I found that I did not. So that was, you know, that was nice to hear that I wasn't totally crazy, and it was just completely inexplicable.
Yeah, when you break it down like that, you know, then absolutely it feels like there is a little bit of a trail. But I'm glad that you called out like these. I mean, you know, the physician workforce has to be one of the highest density professions for these types of traits. And it made me very sad earlier to even hear you call it, you know, a character defect. Even the need for extreme external validation. Because what's funny and what's the flip side of the coin to me is that many of us would not be here without that piece. I guess I don't know that many really well-adjusted people who are driven for extremely honorable, very internal, clean reasons, and they work for a decade to climb to the top of the mountain that you're describing. Like it's very interesting because, you know, and this is very much like a lot of the lessons that I have learned in my experiences in therapy. But, you know, it's like these things, these traits, disposition, tendencies, things like that, they work for us until they don't. Like they also made me the best for, you know, I don't know, 27, 28 years until they tried to kill me. And, you know, like you said, I mean, for me, it wasn't on a dime, even if it felt like on a dime, because really it was the culmination of a 27-year-long journey where it makes a lot of sense with the wisdom of hindsight. But I guess, you know, I would love to know what your opinion is on that, because I don't think that problem has gone away. I think if anything, we hear about how competitive medical school is now. We hear about how super, super terrifyingly competitive various specialties are, especially, you know, surgical subspecialties, things like that. So it's like, what is the right way for a young person to play it where they're going to, you know, be able to harness all the traits that you described, because they have pros and cons. So like they can harness those traits to get to where they want to be, but not let them be controlled by them or get waylaid by them.
Yeah. Well, let me just say right quick that my mentor in the coaching arena, Dr. Mel Thacker, she's not a fan of the term character defects either. That's a recovery term. But anyway, that's where that comes from. But to answer your question, and again, I'll speak from my own experience. I knew if I was really being honest with myself, I knew that I was headed toward, I knew that I was on a trajectory that was not going to end well unless I changed things. I would be lying if I said I didn't know that.
At what point did you know that?
I would say, well, right around 5 years after private practice. So I had almost built everything up completely. I could see the end of the tunnel. And I wouldn't say I was a workaholic because, we're ENTs. Even if you work really hard, you're working 60 hours a week. But I was also coaching, sports teams and doing all kind of other stuff. But I could tell that I needed a break, that I needed vacation days, that I needed to slow down. And I just kept telling myself, well, I'll do that next month or next year, or yeah, I'll take more vacations next year. So I knew, I could feel it. I knew that I wasn't going to be able to keep up that pace forever. But that time never came for me to do that on my own.
Yeah, it's tough because, again, I see the push and pull of it. Because if I listened to every warning sign that my body or mind gave me over the past decade, who even knows? Who can fathom that I might be living on a commune somewhere? Because, part of what selects people like us to do what we do, I think, is training your bladder to not have to use the restroom for 15 hours. Training your mind and your stomach to be like, we don't listen to you guys. We're just going to get these tasks done well and efficiently. And, so it's very interesting. And I love this because I learned this through more of like the marketing world, but SEO is a term that comes up a lot. Search engine optimization. It's how they get things to rank higher on Google, things like that. But it's also referred to sometimes by people as somebody else's optimization. And so I think it's interesting. It's interesting to think about or kick around these ideas because, we are, if anyone gave the two of us a task, I just think that we would kill it. Like, we are kind of like task experts and machines and thinking experts and machines. But it's interesting because that does not equal like optimized for life.
Yeah. Well, I'll say, in terms of what character strengths and character or personality weaknesses make us good physicians, but also put us at risk for, adverse personal events. One is the ability to do something that you don't want to do well. So most people can do what they enjoy doing well. It's a different story to do something that you really don't enjoy doing, but still do it extremely well. And I don't know what, personality trait that matches up with. But whatever it is, I seem to be high in that. But the flip side of that is that I suffered, sleep deprivation, just any of a number of things. My patients didn't suffer. My partners didn't suffer. Anyone I was working for didn't suffer, but I suffered. And then consequently, my family. And so that would be a good place to kind of draw a line in the sand. When you can feel yourself, your body, your mind, your family life start to suffer, it's time to change course.
Yeah, I love that. I think that that's good advice. I'll piggyback on that and say that for me, one of the biggest signs of, I think, inner turmoil and trouble and warning is that when I was a resident, it started that I could just no longer tell what was important or not, or what was an emergency or not. Like in terms of clinically, I was good. I had good clinical acumen. I could triage things and like tell, okay, well, this is going to be an airway emergency. This is an emergent trach, X, Y, or Z. But then in my personal life, if my husband like didn't remember to do something that he said he would do, it would legitimately like break my mind. Like I just couldn't tell the difference between, and this goes back to rigid thinking where like, well, if somebody says that they're going to do something and then they don't do it, whether that's in the hospital or if it's in my personal life, it just kind of like did not compute. And again, in terms of talking about things that don't make you like a very optimal human, it was for me like an early sign to look out for. I mean, I just could not tell. Like the rules were just like the rules across the board. That might have been because I had like lower programming abilities because of sleep deprivation and, like stress and trauma from work. So I just kind of was like, I guess we're going to operate on one set of code. And if it's broken in any arena, it'll be like a meltdown.
Wow, I can really relate to that. And so my experience with that is, especially in residency, but also in private practice. But, in residency, for the most part, you're operating at near 100%, not only capacity, but efficiency. So from the time I woke up in the morning to the time I lay down to go to sleep at night, I mean, there was probably less than 90 seconds where I wasn't doing something. And a lot of times doing multiple things. And you're expected to not make mistakes. You're reminded how often that a mistake is unacceptable because the stakes are so high. And then without knowing it, my expectations from my professional life leaked into my personal life. And so the expectations for myself and the expectations for others in my personal life, I started mixing. And, the real world doesn't operate like that. The real world doesn't operate at 100% efficiency. You might go to a restaurant and they might mess your food order up. That's what happens in the real world. That's totally unacceptable in the hospital. And so that was a big source of anxiety and frustration for me, was kind of recognizing those two differences.
Exactly.
I'll also want to say, before I forget, is that the traits that made me a great student, that made me a good athlete, that made me a good doctor and a high-functioning surgeon, those traits are great in the professional realm, and they are not great in my personal life. Perfectionism and trying to control everything, it doesn't work well in the real world sometimes, most of the time.
Yeah, I think like really beautifully said. And that is like, to me, that's one of the biggest things that I have learned in the past couple years. And I hope people can take that away, because I don't think that at any point when I was coming up in training that I heard people like talk about that very much or, warn against it. It was still very much like the glamorization of all of the traits that you're talking about. It was like, and don't worry about that at all. There's not like a dark side to that. And like, haha, like we'll glaze over it. And don't worry about how that's going to impact your family, what kind of friend you'll be, impact on like very real relationships. So I think that that's an incredible note to end on, but I did want to ask you if you could leave people with any advice about how they can, because maybe they're going to relate or say, wow, okay, I've been really dependent on external validation myself. I can relate to a lot of this. It's like, how can people even take that first step to unpacking it or trying to think and live differently?
That's a good question. Well, I'll start by saying, it wasn't until rehab that I really had even appreciated the term external validation. And it was definitely not until rehab until I learned that that was an issue with me, and it was a negative issue with me. That I had been so dependent on other people, outside sources, telling me that I was doing a good job for me to feel good about myself. And so the first step for me in eliminating that as kind of a source of self-love is just to appreciate the fact that I don't need any external validation. I don't need any achievements or success to make me a good person or for me to have a high self-worth. That's unconditional. And so that's the first step. And that might be kind of a fluffy answer. And it's easier said than done. For me, that was very hard to come to terms with. If I wake up in the morning and I don't do anything for 3 hours, that doesn't mean I'm a bad person. That doesn't mean that I'm not being efficient and, I've wasted 3 hours, So that's step number one.
Yeah, I get it. I mean, I even bristled at it just now because you said that and I was envisioning waking up and spending 3 hours not like producing anything, and I bristle. And it's because, it's so funny. And we talk a lot on this podcast about like how maybe you need to hear the same message multiple times before it'll hit correctly or hit differently to where it's actionable. If I could go back 10 years in time and then talk to my younger self, and that girl, by the way, was warned, like, oh, like I feel like there were ways and signs from people in my life of being like, you might be dependent on external validation. Like you're getting a lot of accolades and you seem like maybe to run on them. And I would be like, what I'm hearing is that I'm getting a lot of accolades. Thank you. And I'd be like, awesome. I'm going to continue. Like, that sounds great. I mean, you hear what you want to hear. And so it is funny, but I would never miss an opportunity to kind of like metaphorically shake someone and be like, it's never too soon to start looking inward. Even if no one else is talking about it in medicine.
And let me follow up with that. My first answer was fluffy. This one is a little more practical. And so one thing about recovery, one thing that I learned and that most people need to learn to be successful is that recovery is a journey, meaning there's not a beginning, middle, and an end. And so prior to that, my whole life has been about setting goals and accomplishing goals. College, med school, residency, studying for this test, this class, everything had a beginning, middle, and end. And my level of fulfillment was 100% tied to the result, to how I did when it was over. Recovery is a journey. There is no end. And so what I needed to learn was how to enjoy the process. And if I thought back, those were some of my best days was building my practice. And if I had known this then and thought at the time to slow down and enjoy the process of building and stop always thinking about the end result, that would have helped external validation have less of an impact.
That's very beautiful and a great point. I mean, like I have a new appreciation in my 30s for this whole philosophy and enjoying the journey. Because again, like in my 20s, I was just a nightmare. I was like, I will not enjoy the journey. I will enjoy the mountaintop, but that's a lot of stuff that I was really not ready to receive in my 20s, I guess. But Brett, again, I thank you so much for being here today. I'm incredibly moved by like your candor, your wisdom. I feel like I learned a lot from you, and you give ENTs a good name. So like shout out for that. Where can our listeners find and connect with you online?
Okay, so I'm kind of in the beginning of my coaching business. And what I'm training to do is to be a private coach for physicians who are experiencing symptoms of burnout. And so my Instagram and Facebook handle name is the Burnout Doc. I have an email right now, which is theburnoutdoc@gmail.com. Website is pending. Again, I'm really early in the process. So the Burnout Doc is what, if people could remember that, they'll be able to find me doing that.
Wonderful. And we'll, link to your socials in the show notes. Absolutely.
All right. Thank you so much for having me.
Of course. And, maybe we'll get to connect in the future more deeply about like PHPs and some of those Pandora boxes that I was like, just shut that. Like we don't have time today, Brett. So it'd be fun to think about in the future.
Yes, I have a lot to talk about with those.
Follow me on Instagram at francesmei.md and at Rethinking Residency. Visit my website, rethinkingresidency.com, to learn more about resident physician stories and ways that residents can most effectively navigate the game of residency. Thank you for tuning in to this episode of Promising Young Surgeon. If you enjoyed the episode, please subscribe, rate, and leave us a review. If you or someone you know is struggling with addiction or mental health issues, please reach out to a professional for support. And remember that you are not alone. Thanks for listening to Promising Young Surgeon, and we'll see you next time. If you'd like to submit any questions for future episodes, email me at pys@heyinfluent.com.